Now I'd like you to welcome back to Philadelphia, Valerie Esqueda. Am I saying that right? Esqueda. She has been in New York, was in Philadelphia, Minneapolis, and now her business is returning to Philadelphia. So we're really happy that you're coming back to us. Today she's going to be talking about LifePlace approach and transitional consumer proceeds. And I'm going to invite you to continue your introduction.
Oh, thank you. One thing, how do I work the clicker? I should be, is it the middle one? Oh, advance, I guess, huh? All right, we'll find out. Hello, everyone, and thank you so much for coming to this presentation on LifePlace and the transitional consumer, where we will look at how healthcare and consumers can co-navigate their way through what I think we can agree on is a very a landscape full of change. I'm okay, let's see, is it this one? This one? All right. Sorry. Hooray. Okay, I'm Valerie Esqueda, clicker unacquainted with. But I am Chief Digologist of CultrDig, and we do qualitative research within the context of the surrounding culture. I'm a bit of a user experience junkie, so I'm going to have an issue with Kensington. But I apply user experience principles to interpreting and gathering data. So this comes into play quite a bit with how this design of this approach has come about. I am in Philly and in Minneapolis, and our company has both US and global experience. And our partner is Mpanel. They're in Flowery Branch, Georgia. Eric Moore is president, and he has quite a bit of experience in healthcare, both B2B, B2C, and what they bring, we're excited to partner with them because what they've done is developed a very highly incentivizing survey research program for our panels that really brings in a high quality level of panel participation and a high quality level of participants. So what is LifePlace? LifePlace is an approach that recognizes throughout our lives, we go from one place territory to the next. And as we go through these processes, we realize that, a LifePlace, excuse me, I'm sorry, I should back up a minute. A territory place can be a business cycle, it can be a business stage, it can be a life stage or a life condition, anything that involves change. Because when we go through change, we navigate our way to this new destination that quite often isn't quite yet defined. So our life cycles and our business cycles are very predictable. However, as our landscapes shift and change in ways that are unpredictable, the way we navigate these new paths change as well. So, for instance, in this example, and I think we can all relate to this has become a more common experience that probably didn't exist 10 years ago. Someone that's starting a new family might be 50 years old, and ordinarily, perhaps ordinarily they would be going into a retirement stage. But now they are going into what would be a starting a family stage. And now they're navigating a completely new way of living that is probably unfamiliar to them. Likewise, in a business cycle, a startup would go to growth and then expansion. However, in a growth phase, they might go right into transition. And so suddenly they're navigating in a very different, they need to navigate in a way that they weren't expecting as well. So what this means is that the paths that used to be pretty well laid out for us, we really can't follow anymore in those footsteps of that which came before. So how do human beings navigate their way through these shifts? We use cultural guideposts. And what that is, it's a blending of new information with the old so that we can find our way to a place that's probably still being defined. And we've done this, if you think about it, for thousands of years. So this is something we innately know and we innately do. Now, if these guideposts disappear, we co-create new ones with each other so that we can all find our way. And I think we can probably think of many instances in history where that has happened as well. Ultimately, our cultural guideposts tell us how to find our way to a desired direction or how to steer away from an undesired direction. And they, in the end, tell us when we've arrived at the place that we think we want to go. So how can the healthcare industry identify and benefit from culture change and guidepost creation? That is with one way is with a transitional consumer study. And a transitional consumer study addresses this new paradigm of culture change and changing landscapes and guidepost creation. So I'll briefly go into we don't have a whole lot of time. I'm happy to go into this in more depth after the presentation, or if you want to email me or contact me. But initially, we conduct a filter study where we have a series of filter questions to get a sense of emerging or in progress transitions. Then we do a drill down to better understand what those transitions might be, what they look like, what people are using to guide them, and we employ semiotics to start translating and interpreting these. So a traditional, how to think of this, is a transitional consumer study might be used to inform needs assessment, a feasibility study, program development, maybe perhaps a multidisciplinary team, care coordination, expansion efforts, and partnership development. And those emerging needs that I think we're continuing to see that are coming into play with some of these changes that are coming down the pike in healthcare. So a transitional consumer study operates within the context of healthcare and healthcare change. And some of these impending or in progress shifts that we're seeing are things like transparency, bundled payments, do-it-yourself healthcare, patient apps, ER mandates, millennial wellness. Let's see, I think the newly insured, telehealth, to name a few, just a few. So, for example, let's say we do a lifestyle study. And this would be phase one of this kind of a study, where we would ask a series of questions to identify possible shifts. So in this case, we might ask, tell us the likelihood, please rate the likelihood of remarrying, or rate how involved you are with your health care. Perhaps how interdependent are you with your family? We might ask people to rate themselves to what extent they identify themselves with being a do-it-yourselfer. So then, based on what the answers, we start to look for patterns of what this might implicate. We might identify one shift, we might identify two. We sift and see what we're coming up with. So I'm going to use an example here of, let's say in this case, we discover a consumer shift that is about intentional housing. And from everything that we're seeing, everything that's coming back, we're going, hey, this really sounds like intentional housing, co-housing. How many of you are familiar with that development? Is there? Okay, so intentional co-housing is when a group of people come together, and it's very intentional, and they create a community. So in some cases, it might be in one house where 5 or 6 women decide, hey, we all want to live together with our best friends and take care of each other, and they set that up as how they want to live out the second part of their lives. Or it might be a bunch of groups of people that decide they want to live in separate houses, but be a part of a community. But the basis of this would be that it's a work in progress. The destination is still undefined. They haven't quite figured out how this is going to work, but they're starting to do it. It's got a pretty significant demographic potential. This is a highly, highly inventive demographic. They're do-it-yourselfers, they're problem solvers, they figure things out, and this is a chosen way of life, and it's co-created. A big part of intentional co-housing is that it's very resource sharing based, and they pool their resources together. So that might be one very important development that we're seeing that has a lot of implications for healthcare. Another might be multi-generational co-housing, which is something that could also be a significant demographic. This is different because it's frequently not intentional. It might be that you've got 3 generations living together. It's a complex situation. You've got, it's very guidance focused, and it's very familial. We might see something in our findings that says that maybe these are residences that try to live within, or they move in with a relative that's within 5 miles of a medical center. So, and this is also a very highly multicultural demographic. So when we take these possible shifts, we might take one, we might take both, depending on what seems to offer the most opportunity and what aligns most with objectives, is we do a drill down. By that, I mean we look for, or we identify the most appropriate methodology. In this case, I'm going to use online communities as something that probably would work best for this kind of a drill down. This example I'm using in particular is one that is called, it's an engagement, based on an engagement theory that was created by Alex Hillman from BetterWorks. And one thing I think is really great about this kind of approach is that part of it is identifying what people say and you know, kind of the ways that online communities have worked in the past for research. But what it also does is it backs off a bit and observes how people gravitate and move towards that center common goal. So you get a sense of who's stepping forward, who's moving back, who's becoming an influencer. And you find this can be a very vibrant, informational way of understanding who's following who, what's driving who to what are they identifying with. And this is more of a hands-off approach as well. So with that information, we start getting ideas and clues for what are some guideposts that are emerging, or ideas, topics that maybe the guideposts aren't there yet, but they're clearly what people are looking for. So for instance, maybe in intentional co-housing, we might start seeing things that imply, envisioning and empowerment. Maybe we're hearing things like open, airy, rich discovery, very do-it-yourself or take control. We might be hearing things like bonding, sisterhood. There can be any number of themes that start coming from this. Or take, for example, maybe multi-generational co-housing, multi-generational housing, where we might be hearing things like, complexity, or that it's very duty-bound, that it's very guidance-seeking. We might be hearing talks that infer to color. But what we do with this then is we start applying semiotics to look at how we can think about the information that we're getting in terms of texture, sound, color, perhaps a cultural relevant image, music, and then we take those, and the next phase is to apply them. So what we take from those guideposts and what people are looking for is we start asking, well, how can this be applied to service design? How can this be applied to a communication program? How can this be applied to a product, whatever is the focus? And how can this be internally applied as well to an organization? We also look at how can we apply metrics, because this is also a very important part of this journey. And finally, keeping track of participants so that they can be used in future studies and for future knowledge gathering. And then finally, looking for ways for growth, cost control, and innovation. And then comes the last part of this, which is measurement. Very important to be able to measure, right? So we look at then, depending again on what these objectives are, how well are these guideposts being communicated? How well are they being taken up? Where do those adjustments need to be made? And are there opportunities for cost savings if that's part of a metric? How well is this journey, the efficacy of this journey? And how are people feeling like they're getting closer to where they're trying to get to, or are they getting farther away? So all this can be applied into understanding what people are using to guide themselves and how healthcare and the consumer can work together to get to where they're trying to go. An example I'll use too as we talk about how this gets integrated is, for instance, if you're talking to, and for this example, say intentional co-housing segment, then perhaps they're talking about light, sunny, bright, airy, cheery, energetic, and then maybe it's a health service that goes to this community. And so if you send somebody that's dressed in beige, that's not a guidepost. That says, I think we've got the wrong people here. So this is just an example of how you start applying it just in all sorts of channels. And another thing I should mention too is that it's an important part of Guideposts is to understand channel communications, because when you're a guidepost, you want to place yourself in a place where people are looking for you, and also you want to place yourself through the channels that they're using to find you. So this is an example of some deliverables that might come through something like this, which would be perhaps emergent cultural schemata. So there's a better sense of what's happening. Then again, getting back to the guideposts, and what are those emerging guideposts? What's being co-created? What can be co-created? And then finally, success measurement, so that you get a sense of what you're accomplishing and how that can be adjusted, and get a sense of how effective those decisions are. So what a transitional consumer study does is, through a high quality participant pool, a transitional study looks for emerging guideposts, co-creation, and navigational opportunities for both healthcare and consumers to reach this common goal. And by becoming a part of this journey, healthcare stakeholders can have a more beacon-like role to help consumers get to where they're trying to go. So thank you all for coming. I welcome any questions, and I'd love to hear any additional comments, thoughts that you might have. Please track me down, or if you like more in-depth information, because I know this was a pretty quick walkthrough. So you can track me down or email me at Valerie@CultrDig.com. Thank you. I don't know if we have time for questions. Okay.